good morning, everyone, and thank you for joining us today. We have Ken Johnson, who invited us. Thank you, Ken, for allowing myself and Anthony and his team to speak today to the Chamber. You on here, Ken?
Yeah, I'm here. Thank you very much, and looking forward to your presentation and the great benefit you're going to give to the people who are on the call.
Absolutely, absolutely. So today we're going to talk about risk management strategies for reopening your business. And I'm Jennifer Anderson. I'm with a company called Bizzuto and Associates Insurance Services. We are actually Campbell Chamber members. I'm in downtown Campbell, although physically I am at home still. Haven't returned to work yet and hope to be able to do that in the next couple of weeks here. Also on the line here is Anthony Poston. He's the CEO and risk manager for ESM Insights with his partner in crime, Sinead Scrisapi, and of course, Ken Johnson. So welcome, everyone. So, oh, sorry. Anthony, please tell us about ESM.
Yeah, I'll just jump in real quick, just a high-level overview of who we are. We are a workers' compensation risk management company. We focus on safety prevention, CalOSHA compliance. Should an injury occur and seep through our risk management strategies, we have a claims management team that interfaces on behalf of the employer as well as the broker with the insurance carrier to move those claims to closure. And then we also work to bring those employees back to work. And that effectively helps employers to manage and reduce the cost and risk associated with workers' compensation. We also have a technology portal where we provide all of these services, including a pretty robust and rich compliance library. So really excited to be on the call today, share a lot of the strategies that we've been implementing across multiple industries. Ken, special thanks to you for inviting us. And of course, Jennifer, partner in crime, we've been doing these webinars quite a bit. So we've got a really exciting and informative webinar for you today. Thank you.
Thank you, Anthony. You should probably let me do your intro because I got to tell you, Anthony and his team are a lifeline to our agency. We work with them all the time and have done so for many years. We at Bizzuto Insurance supply liability insurance, workers' compensation, employee benefits. Our office, as well as through our partners like ESM, provide safety management, claims management, return to work programs to help you contain costs when it comes to your workers' compensation and insurance programs. And we've been in business for over 40 years. We're part of an international brokerage called Acrisure. We're a top 10 international brokerage firm. So we can help you with all of your insurance needs. And we have been smart enough over time to align ourselves with people like ESM to put together programs like this. When this all happened, I think March 17th, we all went into the shelter in place, and Anthony and I were on the phone together a couple of hours later, and that very same week, we put together an exposure plan for people because people were just dying for information on how to deal with this. So those are the types of things that we do in partner with ESM. So thank you for having us today. Okay, Sinead, we can move to the next slide. So we're going to talk today about workers' compensation. It's going to have a workers' compensation focus, although it does drip into a lot of different areas within insurance and safety. We'll talk about safety and the CalOSHA compliance. So we'll put a framework together for risk management strategy to return to work based on the requirements that are set up by OSHA. And then we'll follow up with a Q&A. If you have questions during the program, Sinead's going to be kind of monitoring that, and we'll bring those out during the program as well, but we'll leave a question and answer at the end. It's a lot of slides. We're going to try to keep this within an hour, but and all of this information will be available, both a recorded and all of the forms will be available on our websites, and we'll send it out via email as well. So what we've tried to do throughout this shelter in place and the pandemic is make sure that we have things that, there's all these plans that come out, but then you get thrown all of the information and then you have to go reinvent the wheel or actually create the wheel in this case because nothing like this has ever happened. So we put together, ESM has put together an exposure control plan. We did that actually, I think the first week out of the March 19th or something like that. We put together the exposure control plan and gave that to employee customers. Then we put together the next week a remote work from home. Everybody all of a sudden went from working in the field to working in their home offices, and all of the different challenges that came with that, as well as the programs that needed to be put in place and the policies and procedures. So we put that together. These are all on our websites. Then we did a managing claims during COVID. There's still other claims that were prior to COVID that we need to make sure we don't lose sight of. So we talked about that. And then, of course, return to work. And next week we'll be talking about the executive order and Gavin Newsom put out last week that talks about workers' compensation covering these COVID claims and what that means, how to manage it, and what you need to do as an employer. So we'll have that hopefully next week. So Chubb's CEO, Evan Greenberg, says COVID-19 will be the largest event in insurance history. I have no doubt in my mind that he is accurate in this. You know, we thought the 9/11 attacks tipped us over, and it is nothing compared to what has transpired here. And there's going to be long-lasting effects to every industry, including the insurance industry. So we'll talk a little bit about how that's going to affect things in the coming months.
Jen, I just read that Lloyd's is going to be paying out about $4.4 billion.
I saw that. Yeah.
It's pretty remarkable what that's going to do to the insurance industry.
Long-term effects, and you know, unfortunately, don't kill the messenger here. But what it will end up meaning is, of course, increased premiums. We've been in a really soft market for probably 8 or 9 years now. It may not feel like it, but if you had compared, you know, 10 years ago rates for workers' compensation and liability and even commercial auto until the last 2 years, rates have been very, very low. That is going to shift, especially if things change with, you know, some of this business interruption, which we'll talk about. We can go ahead and switch to the next screen. Am I able to change screens here? Or does Sinead need to do that?
I believe she needs to do it. She's the presenter, but it looks like we just have a little bit of a delay.
Oh, is that okay?
Can you see it now?
Yeah, there we go.
Okay.
So again, on our websites, both the Campbell Chamber has a COVID-19 resources are available to you. All of our webinars that ESM and I have been doing are on each of our websites, including all of the policies, plans, procedures, forms, everything that you'll need. And we will be also sending it out via Dropbox afterwards via email. So these are all going to be available to you. All those questions are already coming in. All right, so let's talk a little bit about business interruption claims, because we've been flooded with phone calls. You know, my business was shut down. We're severely hemorrhaging from the financial impact of this. And I noticed that I have business interruption insurance on my business interruption coverage in my policy. So within those policies, almost always, I have actually reviewed, can't even tell you how many policies I reviewed, and only one that I've seen so far did not have an exclusion related to virus. They're not all going to read the same, but this is an example of how a virus exclusion is going to read. And if you read that highlighted section there, it really kind of points out that COVID is not, you know, as a virus, not going to be covered under this business interruption. If you have a policy, and you can switch to the next screen, Sinead, if you have a policy that for some reason doesn't have this virus exclusion, there still is a requirement in all policies that there be direct physical damage to insured property. Again, 2 things that your carrier will likely cite as a decline of coverage and the reason for no coverage under the policy. You can skip to the next one, Sinead. So what we're expecting is a decline from most carriers, but we're still recommending, and you should talk to your broker, even seek legal counsel. We have some partners that we work with in the coverage council that we can recommend to you. because this is something that is evolving. We have legislature going on. They're trying to get insurance companies to cover it. We have I heard over 800 cases in the court system right now, trying to combat these declines that carriers have been giving to insureds. So what we're recommending, talk to your broker, give us a call if you want to talk it through. We're recommending that people put in a claim if they have had one, that they do so under civil authorities. We feel that there might be better coverage if you go at it that route rather than the COVID-19. But again, it depends on the circumstance and it depends on your policy. You have an obligation to notify your carrier of a claim within a certain time period that will be stipulated in your policy. So you want to look at that and make sure that you give your carrier ample notice. And then you want to keep really good track of your records. What were your revenues prior to the claim? What are your revenues during the shelter in place? What are your vendors going to be able to supply for you? Those types of, that type of information is something that you want to keep track of. Keep track of any of the shelter in place orders that affected you. And that way, when the time comes that you have to pull that information, it's readily available. Again, if you put through a claim, which we recommend that you do, even if you think it's not going to be covered, if you have had a business interruption, they're likely going to decline it. At least then, though, you have made the notification that you're required to do in a timely fashion. And if something should change down the road, you've at least got that placeholder there. So again, talk to your broker. Every policy and every situation is different, but that is the recommendation that we would give to people. And we can have a seminar on this that could probably be 2 hours long. But I just wanted to kind of touch upon that because most people have, significant claims here and concerns. So we thought we'd talk about it quickly. Okay, we'll move on to the next slide. So today we're going to talk mostly about California, but it's important to remember that in each county, the counties trump the state. So you want to make sure that whatever county you reside, your business resides, and or your project, that you're following those codes. So we are going to talk about California today.
Looks like we got just a little bit of a delay as we move the slides.
All right. So a couple of good things that we're waiting to hear about from the Department of Insurance. The Rating Bureau of California, who oversees workers' compensation, has recommended 3 things that are going to make employers very happy if we can get them passed. The first one is clerical classification. The second one is that we remove payroll from so if you furloughed people or you had people work from home and they, if you had people work from home that were normally a field employee, let's say, they're allowing you, or they're proposing that they allow you to use the 8810 clerical classification instead of maybe the carpentry or manufacturing code that they were using before. They've also recommended that the payroll that you paid, even if the employee was not working. So shelter in place came into effect, and a lot of people sent their employees home, but continued to pay them during that time period. Normally, that still would be an auditable payroll and workers' compensation. The Bureau has recommended that the Department of Insurance say, okay, we appreciate that you did this. We're not going to charge workers' compensation on that. And I definitely think that they should do that, and hopefully they agree. And then the COVID-19 claims not affecting your experience mod. Let's flip to the next slide and we'll talk about that. So again, if any of this goes into effect, the Department of Insurance approves it, you're going to want to have all of your payroll ledgers ready to go. So mark your files, COVID-19. If you paid people that were not working, make sure that that's easily, readily available when you have an audit so that you can pull that out and not be charged for that payroll. Very important that you keep that record clear. And again, if you have people that were not normally in a clerical field, but you had them working from home in a clerical capacity, we are hoping that the Department of Insurance allows you to switch them into that clerical code. Once they go out of it, unless something, you know, a shelter in place goes back in force perhaps, once you go out of that field, that classification, they're not going to allow you to go back. So you want to make sure that you make that clear in your records when they came in and out of that clerical classification. This is not approved yet, but we're hoping to hear from the Department of Insurance this month, hopefully. And in the meantime, just keep those records clear for a presumed positive reaction from the Department of Insurance. And then, of course, that we can exclude that payroll. We talked about that already, so we can skip to the next one. The next one talks about experience modifications. So if any of you aren't familiar with that, the really quick explanation is when you have a claim, it affects an internal rating factor called an experience modification. It's published, it follows you and your company. If you have high claims or a high frequency of claims, that number can go up and it is a debit on your workers' compensation. It has been recommended that claims associated with COVID-19 not affect your experience modification. Again, not approved yet, but I believe the Department of Insurance is probably going to agree with the Rating Bureau, and they're going to exclude the COVID-19 claims from the experience modification calculation. It will still, and what we don't know is if it will still end up on your loss history report and kind of go against you as far as an insurance carrier's underwriting of your account. So that is still yet to be seen.
On that, we actually have one of our clients, it's a manufacturer, and they just confirmed that they had 3 COVID cases. We don't believe it's work related, but they are going through that whole decision tree process of determining whether or not it is. And the one challenge, even though these claims won't impact the XMOD, you still have an injured employee and you still need to manage that. So there are the indirect costs and time and expense that goes along with that. So a lot will still play out in the courts, which will help us define some policies and what we can do. But I think what we're talking about in these next few slides is really going to be on how can we prevent these employees from catching COVID-19 through various risk management initiatives. So we have to deal with those indirect costs.
Yeah, and I think next week as part of our webinar, we're going to talk about, you know, even though this is uncharted territory, we're going to talk about, okay, let's say you come back to work and somebody does become ill, and what you have to do in that scenario. What kind of reporting do you have to do to other employees? What kind of disinfecting do you have to do? Those types of things. We're all still formulating responses to that, but we're going to try to give you some tips and policies and procedures around that. Workers' compensation carriers, you know, I have renewals coming up and they're already starting to ask, what's the person's exposure plan? How are they dealing with COVID-19? What have they done? Did they furlough people? How are they disinfecting on a regular basis? How is that documented? They're asking all of these questions and expecting people to already have these plans in place. And quite frankly, a lot of people don't. For those of you that are smart enough to be on this phone call, you will leave with those today. So, and you can truly just, you know, put your logo on them and customize them to meet your particular business's needs. So these are things that your insurance companies are going to ask. It's something you should talk to your broker about because it will set you apart and it will help in the pricing of your coverage. Okay. So there's 4 stages, at least today, there's 4 stages in California about surrounding the reopening. I know a lot of counties are already at stage 2 here. Unfortunately, in Santa Clara County, we have not moved into that area yet. So we still don't have retail establishments, at least not most of them, able to, you know, start back to work. Hopefully that's coming. But as you progress down stage 3 and stage 4, we have stage 4 being, you know, the highest risk with large gatherings, concerts, convention centers, live audiences, of course. So each one of these will have a reentry that's separate, that's different in each county, and different requirements for each county. So we will talk about depending on what stage you're in. Somebody's asking about Santa Clara County. My understanding as of news this morning is that we are not in stage 2 yet, that we're still in stage 1. So if you can work in an office, or if you are in an office and can telecommute, that you're still required to do that, and that most retail establishments, there are definitely differences though. Some retail establishments are able to, depending on who they service and what they service. So you really want to kind of look at the essential worker description to find out if your company can reopen. Okay, Anthony, I think this is yours.
All right, thank you, Jennifer. And I think I'm getting a little feedback here. Let me adjust my mic. For those of you who are not familiar with Bozzuto and Jennifer and her team, they are just a fantastic insurance broker. We've worked with them for a very long time. We have such a great relationship that we're able to collaborate on these types of strategies and really keep our ear to what the federal, state, and local levels are saying, and then taking that information and filtering it into actionable tools, which is what we're going to go through here. And so although Santa Clara County has not moved into stage 2, at least for the whole part, we do have a lot of construction that's come back online. We're going to talk a little bit about construction. I don't know if we have any construction employers on the list here, but we'll quickly touch on what those new requirements are. We're going to talk about just some general return to work challenges, from psychological challenges to challenges of having employees that have been sitting at home degenerating for a while. And those employees don't have those work disciplines like they had pre-COVID. And so now we need to get them back to work, back to a normalcy. And unfortunately, my kids are in the background. If you could probably hear them, I try to give them lollipops to keep them quiet, but this is the new norm. So we'll try to remove that soundbite out as we process this recording. So going back into the middle of here, you can see employee disciplines have been forgotten. We have new employees that we might be hiring. So some employees are not going to be coming back to work. And that's going to be a challenge because we're going to be hiring new employees who are not familiar with our stores, our projects, our processes, and we're going to have to train them and get them comfortable with this new environment that we're going to create. And those employees that we are bringing back, we might have a new site because of engineering controls and helping to reduce the exposure. So we're going to have this resite orientation. And then of course, there's not a one size fits all for all of us. So Sinead, let's go to the next one. And so psychological hurdles. I think this is going to be one of the biggest challenges that we face. And Jennifer can talk about one of the surveys that she sent out to her team. I've talked to a lot of our team. I know other employers are talking to their employees, and there's going to be a real challenge to bring people back. A lot of anxieties and fears have been built up over the last 60 to 90 days, and leaving the safety of our home and coming back into a work environment is going to be fearful. We're going to have these fears, these anxieties, and we're going to have to try to overcome that. And the way we can do that is by having a really good exposure control plan, a risk mitigation strategy that we're going to walk through today, a 6-point step. And we're going to communicate that with the employees and help ease some of those anxieties so that when they do come back to work, they do feel comfortable to a certain level. And of course, if you see down here at the bottom, if you have an employee assistance program, I recommend that you have that available to them so that they have a resource that they can reach out to, because we're going to have to go through this mental reconditioning, this physical reconditioning. We're going to have to retrain our minds and our bodies and get these employees back to a comfort level where they do feel comfortable coming back into the work environment. And that's going to be a big challenge. So what my plan today is to give you tools and a risk management framework that you can use that's going to help reduce the exposures, to help flatten the curve, and help communicate with your employees so that we can overcome some of those anxieties and then we can get back to work. We can go ahead.
Yeah, if anyone wants a list of some of the questions that we asked, it was really insightful to send out a questionnaire. We did it through SurveyMonkey. I think it was free. Just did 10 questions, but some of the ideas that we didn't even think of to help people feel more comfortable are small little tweaks that you can make. And if it can boost morale and make people feel comfortable, I think we want to do that. So if there's anyone that's interested in some of the questions. There's nothing too deep about it. We just wanted to get people's feedback on how they felt and how they've been affected, because sometimes we don't realize what they have dealing with going on at home. You know, lots of kids in the background on every call. So probably most of you know that people are having to homeschool kids. It's a challenging time. So I highly recommend the survey.
I'm actually working on a scorecard with one of our larger nonprofits about that exact challenge of kind of scorecarding the employees, and based on these 10 questions, you know, how likely are they to come back? How comfortable are they feeling? And these questions will help define what the expectations are of a staffing standpoint. So if we do expect these employees to stay home because unemployment is paying really well right now, they might not be coming back to work for that. And so we're running into all these hiring challenges, rehiring challenges, and we haven't really even fully entered stage 2 yet. But it's good to start having this dialogue and start preparing for it, so that when stage 2 does fully commit, then we at least have a plan and we know what, from a staffing standpoint, what this is going to look like. And then we can work on the engineering controls, the social distancing protocols, and so forth. If we do have construction employers on the line here, I just want to quickly touch on this. Construction came back online. Let's see, it was a week
from Monday.
ago.
Week from last Monday. Yeah.
Yeah, so on the 4th. And those requirements, in order for them to get back to work, they had an 8-page order from the county health department. And you can see these 8 tiles right here really cover the highlights of that. And I just highlighted the most important one, which was having a third-party job safety accountability supervisor, a JSAS. And this JSAS auditor or inspector is going to come out to those job sites and ensure that the social distancing protocols in place, the risk mitigation strategies related to COVID are in place. And so I had received a lot of phone calls about whether or not we can provide that. And Sinead, you can go to the next one. And although we can't, because we're not staffed to be inspectors, if you have heard of OnSite, or even if you haven't, OnSite, they're a wonderful partner to Bizzuto and to ESM. We use them extensively for a lot of first aid treatment. And so essentially they are a team of paramedics that provides first aid treatment on site to an employee's facility or a job site, like construction, manufacturing, agriculture, and so forth. They're bilingual. They're a wonderful resource. Virginia, the CEO, because of all the job sites for construction that shut down for 60 days, had to lay off a significant amount of people. And then sure enough, a few days later, the county health department issued this order saying, construction, you can come back online, but here are the requirements. You have to have a JSAS inspector come out and provide this COVID auditing. And then what she did was hire all of those people back, train them appropriately, and then you can see here are the services that are provided. They can review your site-specific plans. They can do temperature screening. They actually do have COVID tests that they can run, which is fantastic. They got their hands on thousands of them very early on. And then they also provide that JSAS resource. They are ready to go, ready to be deployed. You can go onto their website there. You can go to their phone number. You can call them if you need this resource, not just for construction, but other industries. Please feel free to use them. Again, they're a wonderful resource. Jen, do you have any comments?
Just to jump in here, Ken and Anthony and I spoke yesterday, and we're going to be talking to OnSite about potentially doing something for in Campbell for members and potentially non-members, and we haven't worked out the details, but to provide the COVID antibody testing, because I think a lot of us would feel a lot more comfortable going back into the workforce if we knew perhaps we've had it before and we have the antibodies. Those tests, from what Virginia tells me, are done within minutes. Somebody can be told. I would feel a whole lot better, going out and about if I knew that. So as far as that goes, we'll keep everybody notified, but we're looking to put together something like that in the Campbell area for testing.
That's great. Yeah, they're a great resource, even not just for COVID, but let's say we get past the COVID and looking into next year. Using them for first aid response, we could put together a whole first aid strategy that you could use to help mitigate potential workers' compensation costs because of a first aid program and leveraging a resource like OnSite.
Yeah.
Go ahead, the next one, thank you. So further along this thread, we have prepared a specific exposure control plan for construction. We also have one for the general industry. And although construction and the JSAS requirements is mostly for large projects, the tools that we're going to talk about today really apply to every employer. no matter your size, no matter your facility. These are going to be specific COVID-19 risk mitigation strategies that the county and the state are requiring. And we're going to talk about what the governor had rolled out just recently. But again, these tools are going to be available to you. You can see here, this is the link. It's actually a Word document. Feel free to put your name on it, change the logo, make sure that you review this and ensure that it matches up and aligns with your actual operational practices. We're going to talk a little bit more about the details of what's in this plan in an upcoming slide. So Sinead, let's just punch ahead.
I just want to point out, last week after we did this, I had someone call me and say, you know, I just hired and just completed with a safety person, a safety consultant, to do all of this for me and paid a lot of money for it. So, and then furthermore, after review of our program, the program that you put together, Anthony, yours was actually more detailed. So I cannot stress enough, you know, use this, the fact that Anthony is giving back during this time. This is his way of giving back by, you know, supplying all this free of charge to people. So it really is very all-encompassing and meets OSHA requirements. So thank you again, Anthony.
Oh, thank you, Jenny. I appreciate that. So it's coming, it's here. Let's get you ready. Let's talk about what this risk management framework looks like. As Jennifer mentioned, we do have all of these resources that are going to be available both on our website, on Jennifer's website. We're going to get these tools out to you. So Sinead, let's start diving into the details here. So Governor Newsom rolled out the reopening requirements for facilities. You can see these two links down below that'll actually link you to the specific requirements, but I highlighted 5 key sections within these requirements. First is we want to provide a detailed assessment about what our facility looks like from a COVID-19 mitigation point of view. So we're going to have a site-specific plan. We're going to work through some of those details today. We're going to then train those employees on what that plan is and how they can mitigate the spread and #flatten the curve. And we're going to talk about different control measures and screening protocols, how we're going to disinfect, not only on a proactive basis, but also on a reactive basis should somebody come into our worksite that is infected. And then we're going to talk about physical distancing and social distancing guides. So I just wanted to highlight these sections because everything we're going to talk about in the next few slides rolls back up into what these reopening requirements are. So as Jennifer mentioned, these policies are really geared towards Cal/OSHA compliance. When we first rolled out our March webinar, our exposure control plan was geared more towards bloodborne pathogen and aerosol transmissible diseases, BPPs and ATDs. And that was because an infectious disease plan really encompassed those two Cal/OSHA standards and those two regulatory requirements. Now, fast forward 2 months, all the data that's come in, we've analyzed it, we're smarter about COVID-19, and now OSHA has come out with a site-specific COVID-19 plan, which is a little bit different than the infectious disease program that was initially required. So as we get smarter, as we move into these new stages, more information will come available. For example, these reopening requirements from the governor. We're going to make sure that we get you that information and the tools so that you can not only comply, but use those tools to help flatten the curve and mitigate the spread. And hopefully through that process, train your employees and ease their anxieties about coming back to work. So Sinead, let's move ahead here. So we put together a 6-point strategy, and then at that 6th stage reopening, we've got another 6 steps. It's 1 level down. So as we looked at what those reopening requirements are, we can see that this exposure control plan, this framework, really encapsulates what those requirements are. And so we're going to work through a few of these. We're going to give you a lot of tools. It's going to be a lot of information today. You're going to get all these in an editable format. You can go to our websites and download them. Just make sure that you start working through those. And then, of course, if you have questions, Jennifer and I are available to help you. So let's talk about the business reentry checklist. And here's step number 1. So we talked about the assessment that you need to complete for your organization, which is a requirement from Newsom's reopening requirements. So Sinead, let's go to the next one here. Now, here are some general steps that you can start to think about. 1, if you have a safety committee, great. Maybe that becomes your COVID task force. And if you don't have a safety committee, that's okay too. Start putting together your COVID task force team. Maybe grab a few of your operational people and start working through what your reentry strategy is going to look like. If you have high-risk individuals, people that are over 65, have pre-existing conditions, we want to make sure that we try to put them into a lower risk category. For example, if they can work from home, that would be a benefit because you eliminate the risk by not bringing them in and creating a bigger exposure to them. We're going to talk about specific PPE requirements, the social distancing protocols. I'm hearing a lot about employers are going to do touchless thermometer testing as employees come to the job site or work site every day. So we're going to talk about looking upstream and doing a daily health assessment at home. We'll show you some of those tools here. And then you can see some other examples of some operational action items that you could consider. And then on the right side, we've got specific policies and procedures to review. Several of these are CalOSHA compliant, like the IIPP, Code of Safe Practices. And now we've got the health assessment, social distancing, PPE requirements. Those are all specific CalOSHA standards that we have to comply with. And so again, our exposure control plan that we're going to show you is really geared towards satisfying those new COVID-19 requirements. And one thing that I have here at the top, the employee's job description. If your job description doesn't define the physical demands of the job, picking up 20 pounds, pulling, pushing, twisting, and so forth, you really want to look at creating that job description that identifies those physical demands. Because remember, I talked about these employees have been sitting at home for 60 days, somewhat degenerating. And if you're in a laboring position, for example, I have an employer, the HR director, her husband is an electrician. And prior to COVID, he was walking 20,000 steps a day. And then during COVID, he's at home and he's only walking 1,000 to 2,000. Now that's a big difference. And now we're going to take that employee and we're going to throw him back into the work environment and expect that he's fit for duty. And so it's really important to review your job descriptions and those physical demands and have that dialogue with your employees. Hey, are you ready for work? Let's ease back into this. We don't need to go pick up 50 pounds 20 times a day. And maybe we can ask for help, or we can look at new engineering strategies to help minimize those potential exposures. Because what we don't want coming out of this is workers' comp claims that are strains and sprains or slips and falls and so forth. So really important to review your job site job description. Really important to review your site orientation process, because through engineering controls, through social distancing protocols, you might have remaneuvered some of the equipment, maybe put tape down or arrows down. I'll give you some examples of that here in just a second, about how you're minimizing the congestion and choke points where those exposures really could ratchet up. Actually, let's go to the next one.
Not to belabor the employee job descriptions, but I do want to point out too that it is really helpful to have those pre-workers' compensation claim and share with the medical provider network and the doctors that are seeing those employees, because it will help with return to work plans. If you can return somebody to work based on their restrictions, you're always better off in the long run to reduce costs from a workers' compensation standpoint. And if you have that job description with the physicality of that job, it's really helpful for the doctor to work with you in that endeavor.
That's a great point. When a doctor sees an injured employee, they see him for about 15 minutes. And if they don't have any documentation to review, they're going off what the employee is telling them that they do, versus a job description that fully defines physical demands and what the requirements are for that job. And then that helps the doctor determine work restrictions and getting that employee back to work, making sure that they, one, can do the job, but maybe under some certain restrictions, like can't lift 20 pounds 3 times a day, has to sit for 10 minutes out of the day. So great point, Jennifer. Back to the exposure control plan. I showed you the one for construction. Here's the one for the general industry. And here are the specific sections within within both of these policies. One, we define responsibilities at all levels. So I talked about the COVID task force. We talk about the safety managers, supervisors, leads, and employees, what their responsibilities are. We've got worker exposure classification, worksite procedures now related to COVID. Maybe we have some new engineering controls or administrative controls, which are worksite controls. Transmission control procedures. What happens if somebody comes in and they are infected? What are we going to do to minimize that or disinfect and so forth? Temperature screening, touchless screening. We're going to talk about that here in just a second. If you had visitors coming in before, which most retail does, but if you're more of a manufacturer and you had visitors coming in to inspect products or get sales presentations, maybe look at eliminating that requirement until we move into stage 3 and stage 4. We talked about decontamination procedures and then health and housekeeping and hygiene procedures, which are really taken more from the CDC and the World Health Organization. And then we're going to talk more about workplace controls, PPE training. And I can't stress enough record keeping. So Cal OSHA has been sheltering in place like everybody else. I got an email from their consultation team last week that says we're sheltering in place. They're reviewing policies. And one thing about Cal OSHA is if you were on their radar before, they don't forgive and forget. So although they're sheltering in place now, if you are familiar with Assembly Bill 1804 and 1805, that was rolled out in January of this year, and that increased the reporting requirements for employers, and it also increased the Cal OSHA enforcement budget by $17 million. So we've got a bigger enforcement division. They're all sitting at home, sheltering in place, and they're ready to get back to work. And their focus is ensuring employee safety. They don't care about employers, to a certain degree, I should say. They really care about the safety of employees, and they expect employers to put safety protocols in place to comply with their standards, and that is what they're going to be looking at. And now you can imagine this whole new enforcement team coming back online, going back out into the workforce. They're going to be looking for specifically exposure control plan strategies. That's my opinion. That's going to be something they're really going to focus on as they turn up their frequency of visits.
Yeah, and I think just to piggyback on that, a lot of employers care about their employees, but if you don't have a written procedure and documentation of the training, it's no good to OSHA. As far as they're concerned, it didn't happen. So these plans and require sign off. You know, the plans are here, but you still need to relay that to your employees and bring them back on knowing these new exposure plans. So and then have them sign off on that so that OSHA's can check that box that you've done that.
Yeah, and OSHA's perspective, if you didn't document it, you didn't do it. So all the more reason it's really important to have these policies and some of the tools that we're going to talk about here in just a second. So record keeping, I can't stress that enough. That's your affirmative defense to say that you have a plan, you've implemented the plan, and you've got the documentation to prove it. And I could give you numerous examples of OSHA citations that range from 5 to 100,000. And most of those are because the employer did not have documentation of their actual safety protocols. And so you might have really good protocols, but again, if you didn't document it, you didn't do it. Let's go to the next one, Sinead. So part of the OSHA COVID-19 requirement is that you look across your organization and you define based on this risk pyramid where your different jobs or departments fall. So we've got very high to low risk. That's the OSHA pyramid related to these risk categories. And I'll give you some examples. The very high risk category would be, for example, a nurse working with COVID-19 patients, really at the epicenter, high risk, very high risk. And so they want to know how you're going to help keep that employee safe. So you can identify the job, the department, what the associated risks are, and then what is the PPE that's required to mitigate those exposures. And there's a whole other strategy around hierarchy of controls where PPE is your actual last line of defense, which we'll touch on in another webinar. Kind of moving down the list here, there's the high category, which I think more of like a construction company that's building a wing at a hospital to accommodate these COVID-19 cases. We've had several employers on different calls that are actually providing that service. So they're not right there on the front line, but they are in the general vicinity. They're at a higher risk than most other employees in the general public. Then we've got the medium risk category. And at the medium, that would be more of your delivery drivers or people working in the general public. They're out there working with other customers, with other vendors. They're more on the front lines. And so they might be at a greater risk than the low category, which would be your administrative team. And so I'd recommend that you take this exercise, use it as an example, and work with your COVID task force team to define what are our employees, where are our employees at in these risk categories, and what are we doing to minimize the potential exposure to them. So this, again, is a Cal OSHA compliant OSHA requirement. So take this as an exercise, use it with your team, and of course, if you have questions, feel free to reach out to us. Let's go to the next one here. Worksite cleaning procedures. I was actually on a webinar yesterday or the day before. All these days are blending together now. But it was actually a organization that focuses on decontaminating and disinfecting COVID exposures at facilities. In fact, they've been hired to disinfect a lot of the hotels in San Francisco. So Very insightful, really scared me a lot, made me realize that I don't do a very good job at cleaning overall. But one of the things that we talked about is we're going to implement these disinfecting procedures. And here you can see I've got some specific action items that you can follow. But then we need to prove that we did it. And that goes back to that whole record keeping and documentation aspect. So I put together this daily safety and health cleaning and inspection form. It's a Word document. You can change it. You can see we've got these various categories. These might not be completely applicable to you, but you can just modify it. So if you're going to be disinfecting, what are the specific high touch areas that you feel should be disinfected, and what's the frequency of that? And so you might be doing it morning, midday, afternoon. You might just be doing it once a day, but at least start to define what that strategy looks like, and then use this form to go back and verify that you've done it. So the whole trust but verify requirement is really important. You're going to have your team go out and disinfect, and then you're going to come behind them and make sure that they actually did that. So this is your documentation to prove that you did it. And you can see at the bottom, maintain these records per your injury and illness prevention program. Sinead, let's go to the next one. So Jim, do you want to talk about these specific clients? Did I lose you, Jennifer? I'll talk about them. These are actually
I'm
Bozzuto.
sorry. I hit mute because the dog was moving around here. So we do have recommendations, and I know on the member Campbell Chamber list, you probably have people that are in this realm as well that can help. But these companies in particular are set up specifically to do that deep cleaning that is required for desanitization, including they can do bloodborne pathogens and things like that. So if you need recommendations, these are some, and you can also reach out to us.
Sinead, let's go to the next one. And I'm watching the questions over here as well in chat. And let's just address one of those really quickly with regard into office workers. I'll give you an example. If you're working in an office building, it's a commercial building and there's multiple tenants. I have some tenants telling the property managers that they don't want their janitorial company coming in to clean their office. They've actually assigned their own team internally to do the disinfecting. They just didn't want that external variable to come in and influence their exposure control plan. And then as far as the next one, that's just an example. There's plenty more with regards to office workers. I would say that they're more in the low category, especially if they can work from home. But again, it's going to depend, as Jennifer mentioned, are they interfacing with customers or are they just interfacing with your team internally? And then as far as the IIPP and the COVID-19 requirement, Cal OSHA has not revised their template. The IIPP is really 8 elements, and your IIPP should be no more than 10 to 12 pages. You just want to outline how you're satisfying those 8 elements, and then the additional policies underneath that, like the exposure control plan, PPE, hazard communication, bloodborne pathogen, would be addendums. And the reason why you want to set it up that way is if Cal OSHA asks to see your IIPP, you just want to give them that 10-page document. That's all they're going to audit. Then if they ask to see your PPE plan, you can give them your PPE plan or your exposure control plan. You just give them what they ask for. You don't give them the entire program and let them audit that continuously, because if there are any gaps in what your policies say versus what you're implementing on your site, then that's what they're really going to be looking for is, oh, it says you're going to do daily disinfection. You have a daily disinfection program. Show me documentation for the last week that you've done that daily. And so within your IIPP, you might want to say, we're going to do periodic periodic disinfection procedures. So you've given yourself some wiggle room so that way, if they ask for last week, you have last week. Or if you just did it once a month or once a quarter, you still are compliant with your own program. So really important to write some flexible terms within your policies so you don't paint yourself in the corner. But with regards to the exposure control plan, there's going to be specific requirements underneath those new Cal OSHA requirements that are not necessarily IIPP related, but they're more safety management related. And you're going to get to our exposure control plan, so take a look at that, modify it to fit your organization. Of course, feel free to reach out to me. I'm answering a lot of these questions right now and helping employers get back to work. If you haven't seen the social distancing protocols, this is about a 3-page form. It actually started in Alameda County, and then all the other Bay Area counties adopted it. And now we're rolling it out across the state. We're working with employers up and down California to make sure that they've got good social distancing protocols in place. And I think this is a great form to use. This one is an editable PDF. We also have translated it into English and Spanish. So if you want the Spanish version, it's on our website. You can quickly download it. Again, I recommend you go through this with your task force team, review it. Once you have finalized it, post it on your front doors. Let visitors know, let your employees know that we have social distancing protocols within our environment. This is what they are. You're going to train your employees on it. You can get signatures that you've trained them. So again, that's your record keeping requirement per your injury and illness prevention program, but really important to post these and train people on it. And then we can move to the next step, which is going to be more of the engineering controls. So if we have social distancing protocols, you have to maintain 6 feet, then make sure that you have engineered your site to accommodate that. Go ahead, Shanoon. And I'll give you an example of some worksite controls that I thought were really good. So, and actually they were good and they failed at the same time. So I went to a grocery store and I go to the front and there's tents out front where people are standing, blocking them from the sun. And there's tape marks on the concrete that just outline 6 feet distances. So everybody's lined up, everybody's got their masks, their PPE on. At the front, there's a gentleman, he's fully masked in PPE, and he's letting people go in one at a time, and he's getting signaled by somebody who's at the back door saying we have one customer leaving so we can have another customer in. So really controlling the number of customers that are going into the supermarket, which is great. So I go into the supermarket, and I start going straight to the aisles where I know the products are that I want to buy. And as I'm walking down these aisles, I'm getting these dirty looks from some of the other customers. And I didn't really get it at first until I looked down. And sure enough, there's a thin red tape with some arrows, and it's pointing the one-way direction that these aisles are outlined. So really creating the traffic flow. And so I realized, me now being the safety manager and totally overlooking that these were really good engineering controls, but the thing that they failed to do was tell me that they had this traffic flow. And so great on the engineering controls, fail on the training. Had they told me, hey, we've got this traffic flow that we've outlined, take a look at the tape and the arrows and follow that, I would have been more cognizant of it and I would have followed that. And I wouldn't have gone into that choke point, as I mentioned before, which was I broke the 6 foot barrier because I didn't know that program or that process was there. So don't assume that your employees are going to know your engineering controls or your administrative controls. You really need to train them on it. And so you take that as an example. You're creating your social distancing protocols. Now you're creating these engineering controls. Make sure that you train the employees and you've got documentation that you've trained them. And that's going to help you comply with your own policies as well as help us to flatten the curve. And again, going back to reducing some of those anxieties. You train the employees on your programs, your protocols, your procedures. They know that you're taking a very proactive step in mitigating this whole exposure. That's going to help ease their anxieties and help them get back to work more successfully. So here are some other engineering controls from physical barriers, tape or paint marks, as I mentioned with the grocery store, separating desks maybe 6 feet. If you've got a facility and you're changing air filters out quarterly, maybe think about doing that every month. If you've got lunchrooms or break rooms, maybe shut them down for now. If you can eat lunch outside, more important, getting some fresh air. We're hearing a lot about how fresh air and just being outside is helping to mitigate the potential for the spread. Although that was not what we heard in March. We wanted everybody to stay inside, and now they're saying it's okay to go back outside. So a lot of noise out there. We're trying to figure out what the appropriate requirements are. But one thing that's important is, again, minimize the potential of congregation. So trying to keep those 6 foot distances, trying to keep people from collapsing into those choke points, as I mentioned. So reconfigure your work site to accommodate that. And then some administrative controls, which we're going to touch on in just a second. And then general work safe practices that are really geared from the CDC. Health and hygiene frequency, washing hands more frequently, having sanitizer stations, maybe more frequent throughout the facility, donning, doffing PPE. We'll talk about some of those PPE requirements here in just a second. Let's go to number 6 here. Oh, I'm sorry, CDC Posters and Trainings. So there's so many great tools out there, and I wanted to curate just a few that you can use, download, and start training your team on right now. First, we're all wearing masks. So how do you don and doff a mask? Here is a specific CDC training that you can use for your team on how to don and doff. And Donna's putting it on, Doff is taking it off, as you probably guessed. The second one here is personal protective equipment. If you, for example, are having a sanitation crew or janitorial crew, and they're wearing more PPE, from gloves to goggles to aprons, boots, what have you, masks. Here is a great training on the sequence of how to take that on and take that off. Again, great tools that you can download, you can train your team on, get the record keeping that you've trained them, make sure that they are actually abiding by these rules and these trainings that you've provided. The middle one I think is a really good one to print out and just put it right on your front door. If you feel sick, if you have any symptoms, cough, sneezing, and sneezing is a big challenge right now because of allergy season. I'm hearing a lot of people about, I have allergies, I sneeze a lot. And if you're in an office environment and you've been at home for the last 60 days, and now you're in back with your team, let's say 10 to 20 people, and somebody's sneezing consistently, the alarm bells go off. You know, that fear just gets really heightened. And so we've talked to a lot of employers about, if your employees have allergies, make sure that they let others know. I've also heard people that have been sneezing and they thought it was allergies, and 2 weeks later they find out it's COVID. So again, there's no right answers. There's no one size fits all. So if somebody is sneezing through allergies, maybe have them stay at home for 72 hours, quarantine themselves, and then keep reporting back to you on, hey, I'm getting better, things are good, it's just an allergy attack. Or if it's not getting better, and now we need to take another step, maybe go see the doctor and get tested. In the far right here, or second to far right, we've got hand washing posters. If you go to that CDC web link, there's hundreds of them. English, Spanish, for families, for businesses. It's a great resource. I just put that one there because I like that one, but again, there's plenty more you could download. And then the other one, Stop the Spread of Germs, which we've all been hearing about. Don't touch your face, wash your hands consistently, disinfect. So another good handout that you can provide your team when you're bringing them back to work. So have this nice little reorientation packet, and you're going to go through that with each one of your employees, whether they're rehired or whether new hires. Okay,
And for those of you who haven't reopened yet and are thinking about doing so in the next few weeks, or hoping to be doing so in the next few weeks, make sure that you've ordered that personal protective equipment and any cleaning resources that you're going to use now, because I can tell you from my standpoint, we have been searching high and low for Lysol, for masks, of course. We plan to have those at people's desks, and as well as cleaning supplies for their areas. We have about 40 employees in the office, and it's a challenge to find enough resources. So start ordering it now, and you might need several people to go in and buy as they're at the grocery store and so forth. So
I am connected to a safety guy on LinkedIn. His name's Ed Davidson. He's got about 130,000 followers. He makes really good recommendations on safety procedures. And he just posted the other day, one of his vendors that he uses, Divergent Alliance, and I'll put this in the chat. They have boxes of 3-ply face masks. Each case is 3,000. So if you have a larger facility and you're going through those pretty frequently, you do have to buy them in that type of bulk. But it's another great resource. So this nonprofit I'm working with, there's about 1,500 employees, and they're going through masks frequently. And so there are resources out there. I'm getting wind of a lot of available masks from various resources. So if you run into that, you need them in bulk, I can probably help you find them. If you need them just on a smaller order scale, it's going to be a little more challenging because everybody's trying to grab them. So although we've got really good PPE protocols, it's actually getting the physical PPE, which is going to be the challenge. So let's go one layer down. Let's talk about reopening and kind of this safety reboot strategy that we've kind of touched on in various points, but taking this one level down, here's 6 points that you can start to do now for a preparation of rehiring and reopening. Sinead, why don't we go to the first one? So a rehire safety orientation. I've talked a little bit about this throughout this presentation, and the way we set up our safety programs with employers is we first look at the administrative aspect. You've got an HR person, an operations person that's going to be hiring these employees and bringing them into the office. They're usually going to fill out their paperwork at first. So now that we're bringing these employees back, whether rehire or new hire, let's look at some administrative functions that we should be providing to these employees to ease some of those anxieties we talked about, as well as to comply with these regulatory requirements. I mentioned reviewing your job description. If you don't have a job description that has the physical demands, you can go to the Division of Workers' Comp website. It's dir.ca.gov, dir.ca.gov. and they actually have a job description template that you can use where you can fill that out, write the tasks, and then check boxes on sit, stand, push, pull, lifts 20 pounds, 30 pounds, 3 hours a day, 4 hours a day. So they've got a really good matrix that you can just check box. And that would be a great tool to review with these employees, checking for, hey, you've been sitting at home for 60 days, we're bringing you back to work. Are you ready to lift 20 pounds, 30 pounds, 40 pounds, twist and turn, be on your feet for 8 hours a day, where you might not have been doing that for the last 60. So that whole fitness for duty is really important. If you have your injury and illness prevention program, if you have a code of safe practices, we actually take 2, 3, and 4, your safety and health policy, which is defining the roles and responsibilities of everybody in your organization with regards to the safety program, your IIPP and your code of safe practices. We take those 3 documents, we combine them together into employee safety handbook. And so that employee safety handbook complies with Cal OSHA's requirements, and it also looks across your facility and says, here's my primary exposures: slips and falls, strains and sprains, machine guarding, whatever it might be. Then you have those as sections, and then under those sections, here's how we mitigate those exposures. Combine that into your employee safety handbook. And then step number 6 is your exposure control plan, which I talked about throughout this presentation. Really important to onboard these employees and go through these programs. The IIPP 2, 3, and 4, and 5 are Cal OSHA compliance requirements. That's the foundation of your safety program. The job descriptions more on the HR side, and then they review your exposure control plan. So this is really 3 documents that you should be reviewing with these rehires or new hires to let them know we've elevated our safety game, we've got a good exposure control plan, we're going to keep you safe, we're going to be really proactive in helping to minimize the spread as well as minimize the exposure to our facility. So now we bring them into the department level, and now we've got maybe standard operating procedures on how we work the equipment. We've got personal protective equipment requirements related to COVID. We've got social distancing protocols, engineering controls. Maybe our site has been redesigned to help maximize this 6-foot distances. So going through that re-site orientation, as well as those PPE and disinfecting standards, is really important to, again, ease some of those anxieties. And to help you with this, yeah, go back up. There you go. We put together this rehire onboarding checklist. So really captures what I talked about in that prior slide, and kind of checking the box of, did I go through these with this employee? Employee will sign it, manager will sign it. So helps remind the employee of the exposures, helps remind the employee of the physical requirements, and now you've got documentation and proof that you've actually trained them on that. So good onboarding process coupled with an onboarding checklist to verify that you actually completed those tasks. Let's go to the next one. And I know we're running up against time. We talked about an hour. We wanted to try to answer some of the questions during this presentation, so that way we didn't get to the end and have to spend another 20 minutes. Yes, the website that Robert, you mentioned, dir.ca.gov, that is correct. That's the Division of Industrial Relations for California. It's both Cal OSHA and the Division of Workers' Comp. So you can go in there, search for a lot of these tools. They'll give you the standards, the requirements, and then what we've done is take all that information and make them actionable. So let's talk about the daily home health check. As I mentioned, I'm hearing a lot of employers who are going to have somebody at the front desk. They're going to be doing touchless thermometer testing. They're going to be asking the employees these specific questions. Do you have any symptoms related to COVID-19 or being sick? So why don't we look upstream? And here's a document. We've got it in English and Spanish. Have the employees print it out, put it on their bathroom mirror, put it on their refrigerator, ask themselves these questions, because it makes no sense for the employee who knows they have these symptoms to come all the way to the facility and be in front of somebody who's going to be asking the same questions. So let's have them do a self-assessment. If they have any of these symptoms, in our exposure control plan, we tell them quarantine yourself for 72 hours, 3 days, and we'll stay in touch during that process to make sure that you're feeling better. If you're feeling better, we can bring you into work. If you're not feeling any better, let's get you tested. And that way we have concrete evidence on what we can do on the next step. And that would be either bringing you back or quarantining for 30 days, whatever that might look like. So, and again, that's going to change now with these new, with this new executive order from Governor Newsom, which we're going to talk about in our next webinar next week. So English and Spanish, you've identified the supervisor, the human resources coordinator. If this person is feeling symptomatic, have them call in, have them stay at home. No sense for them to come into the office or the facility and potentially increase the spread, especially if they're carpooling. That's a whole nother challenge. And we hear a lot about that to different job sites, different facilities. Second you get into a carpool and you're symptomatic, you're going to infect others. So trying to minimize the spread by looking all the way upstream. If somebody's at home, they've got these symptoms, let's keep them at home until they're getting better. Go to the next one. Daily cleaning inspection form, we talked about this one. So this would be the next step in your rehire orientation process. We do have disinfection protocols. We have a disinfection program. Here's how we're going to monitor that. Again, ease some of those anxieties for the employees to let them know that you're being very proactive with disinfecting the facility. We can go to the next one here. Personal protective equipment. So I showed you the two on the right, the CDC training, the sequence of donning, doffing PPE. And then I put together this one on the left. We have it in English and Spanish. I like this. It's a one-page quick handout to the employees of, here's your requirements. Wash your hands frequently. Use our sanitizer in our sanitizer stations frequently. We're going to require respirators, which might be a surgical mask. It might be an N95. If you've got a bigger exposure, it might be a half mask with cartridge. You know, it'll depend on what the exposures are, which goes back to your risk categories by department from the OSHA pyramid. If you're going to require gloves, here's our gloves. Here's how you don and doff them. And a way to, let's say you have an infection, or you assume there might be an infection. You have inklings that there has been an infection, and you're disinfecting the equipment. You've got contaminated waste, which could be your PPE, could be your towels that you use to clean up. How do you get rid of those? And the best recommendation I heard, because it's really simple, is you double bag it. So you take the contaminated waste, you put it in a plastic bag, including your PPE, and you zip tie that, or you tie it in a knot, you tie it up tight, and then you put it in another plastic bag, you tie that up, and then you can throw it in the trash bin. Now what you want to do afterwards is your janitors, your sanitation crew is going to really clean themselves thereafter, washing hands, face, maybe body wash if they have to take a shower, depending on the level of exposure. But that's a great way to disinfect and then get rid of the contaminated waste. So again, here's 3 more tools that you can use. Again, resources that you can download from the CDC, stuff that we've created as well. The one that we've created is a Word document. It's editable. So again, feel free to take a creative license to it. You're not going to hurt our feelings. We want to help you get back to work and get these employees back to work and get this economy going again. Let's go to the next one here. Physical reconditioning and site reorientation. So I talked a lot about all of these different steps kind of sprinkled throughout the presentation. Employees have been sitting at home, sheltering in place, feeling pretty comfortable because they haven't talked to anybody else. Now we're going to bring them back to work. We're going to expect that they're physically going to be ready. They have somewhat of a loss of kinesthetic sense, and that's your muscle memory. So you've been going to the same site every day for a year, 2 years, 3 years. You know where things are. You almost can just walk in blindfolded throughout the facility. Well, now maybe that's changed because we've got social distancing protocols and engineering protocols, and we've got new traffic flows. So that muscle memory needs to be retrained with this new normal. So make sure that you've trained the employees on what that new normal is, what that new site looks like. And take the grocery store example that I mentioned. Great idea for engineering controls, failed on the training. So let's not fail on the training because that's the most important aspect. Might have some employee turnover. So some employees are not going to be coming back to work, either from anxieties or because of unemployment, or their kids are at home and grandma and grandpa can't take of them because they're high risk. So all of these new variables that we haven't been able to really mitigate or understand, and this is continuing to evolve as well. So although we haven't reached fully stage 2, as we get into that, we're going to have really good plans on bringing these employees back, or if we hire new employees, really train them on our new practices. Which goes into those final 2 at the bottom: new employees unfamiliar with our physical job requirements, and then loss or a new facility or site awareness that we didn't have before.
I think there's just going to take, it's going to take a while for all of us to, you know, get out of the normal way we conducted life. You know, I walked with the dog to the grocery store the other day. I got 75% of the way there and realized I forgot my mask. You know, I mean, we're not used to doing some of this stuff. So I think making sure that we're cognizant of the fact that other people aren't going to be ready to do this, and it's not going to come naturally. Make sure that we write people up and that we document it, and until it becomes habit. You know, it's gonna take some time for all of us to get there.
Yeah, so here's 2 trainings. I've been telling employers to send out the one on the left and send them both out to your employees before they're coming back. Start physically getting ready for coming back to work. Start emotionally and mentally preparing yourself for coming back to work. Start having that open dialogue of, here's our new site. We recognize that there's going to be these emotional and mental challenges. We've got our employee assistance program here for you. We're going to do everything we can to keep you safe and help minimize this exposure so you don't take it home. and then trying to reestablish that good safety practice that you had prior to COVID. So getting a good attitude about coming back to work. We're going to be cognizant of these new training requirements and PPE requirements, social distancing protocols. We're going to adhere to those, and we're going to help our fellow coworkers to keep each other safe. So, again, we're all in this together. So let's make sure that we have a good plan and that we help each other execute. And then lastly, let's go to the next one, Sinead. It's kind of the next steps. So we've given you a lot of tools. Again, they're downloadable, they're editable. Put your logo on it, put your name on it, fine tune it to match your organization's procedures, review with your new hires or your rehires. We want to make sure that we're implementing this, and then we're verifying that we are implementing it through the different forms and documentation I talked about. That record keeping is so important for us to prove that we did it. And then most importantly, let's get back to work. So as we all move into stage 2, let's make sure that we've got a good program in place and we're bringing our employees back to work. And with that, Jennifer, I'm going to give it back to you. Close out.
Yeah, thank you, Anthony. We want to open it up for any questions, of course, that weren't asked throughout the program or the webinar. And then, of course, next week, we plan to do a webinar on Governor Newsom's executive order with regards to workers' compensation and COVID-19 claims being covered under workers' compensation and what that impact might mean to us and how we need to handle that. So are there any questions before we log off here?
I copied and pasted the Divergent Alliance information in there.
Oh, awesome.
I didn't really edit it. I just took it from Ed's LinkedIn post.
Perfect.
And they have face shields as well, I found out. So if
we have Lysol. We need some Lysol around here.
No, that's a tough one.
Yeah.
I'm just scrolling through here. I don't see any other questions. And if there are, please feel free to reach out to us.
There's one question that came in from James. Does anyone know of a good hands-off thermometer? I do not. I know we bought one to test it, and I will tell you that it was not good. I don't remember the name of it, but I do think we need to kind of investigate that. So.
Yeah, I use Amazon reviews to determine whether or not it might be a good one. The other part is just trying to get one. Some of them are on back order right now. Again, I think, we've got these good ideas from PPE and testing. It's just, can we get the tools to actually perform the job? That's right. The big challenge right now, the scarcity. If I do come across any, I'll be sure to roll those out to everybody. You should have Sinead's email address. She's the one behind the screen here working all the details. So feel free to reach out to her. She'll connect with Jen and I on any of your questions or any of your requests, and we'll make sure that we get you more information as we get smarter about this whole thing.
Okay, well, we went a little bit past, but we appreciate everyone being on the call today, and keep watching for new things as they arise. We'll be trying to make sure that we get it out in front of everybody. Thank you again, Ken, and happy Friday, everyone. Take care.
Thank you, Jennifer. Thank you, Anthony. Thank you, Sinead. And you can email info@the-Campbell Chamber, and we'll make sure we get your questions forwarded to the right person to get you answers if you have questions that get answered here. So thank you for a great presentation.
Thank you, Ken.
Thanks so much. Take care.